Hello, everyone, and welcome to our poster presentation on the impact of the COVID-19 pandemic on opioid overdose deaths amongst racial groups in the United States. In the US, 136 people die every day from an opioid overdose, prescription and illicit drugs including. Tantamounting evidence led the US Department of Health and Human Services in 2017 to declare the opioid epidemic a public health crisis. Fatal drug overdoses have been exacerbated by the pandemic, but how drug overdoses have impacted different racial and ethnic communities remain unclear. In hopes of understanding what communities are most vulnerable to opioid-related mortality as a tool to hone public health interventions and policies on this issue, our study seeks to determine how the COVID-19 pandemic impacted the prevalence and intentions of opioid use amongst different racial and ethnic groups.
We conducted an observational cross-sectional study using data from the National Vital Statistics System from 10 months before the start of the pandemic, from May 2019 to February 2020, and the 10 months after the start of the pandemic, from March 2020 to December 2020. For our inclusion criteria, we looked at opioid underlying causes of death based on ICD-10 codes, and the codes we used were for the different intentions of opioid use. The racial ethnic groups we looked at were non-Hispanic whites, non-Hispanic Blacks, non-Hispanic Asian American, Native Hawaiian Pacific Islanders, non-Hispanic American Indian, and Hispanic Latinx. We conducted a longitudinal analysis and calculated the prevalence per 100,000 people based on yearly American Community Survey population counts. Our study had three main findings. First, opioid overdose deaths increased at the start of the pandemic. Second, we observed that the increases in opioid overdose deaths after the start of the epidemic varied across racial groups. And third, we found that the proportion of intentional self-harm deaths decreased across all racial groups, met with an increase in accidental deaths.
Now, going back to our initial research question, we conclude that the pandemic has drastically but variably increased U.S. opioid overdose deaths across all racial groups. Notably, minority groups experienced 36% to 46% increases in opioid overdose deaths after the start of the pandemic, as opposed to only a 24% increase in non-Hispanic whites. A secondary finding of our study is that after the start of the pandemic, Asian Americans remain the racial group with the highest proportion of intentional self-harm opioid overdose deaths at 11.43%, more than doubling the next highest group. Our findings set the stage for future study into the social factors underpinning the varying effects of the COVID-19 pandemic on opioid overdose deaths across all racial groups, and also warrant public health interventions for minority groups in the US.